Mary acknowledges the indigenous peoples who are the original inhabitants of the lands of the ecosystem today. Chirin Haka Notawe, the Chikahamani, Eastern Chikahamani, Natapanai, Monacan, Monacan Nansaman, Notawe, Community, Pataomic, Upper Natapanai, and Natapanan tribes, and pay our respect to their tribal members, past and present. With this, it is my pleasure to welcome Helen Tiffman and Sir Siddharth to the podium. They work alongside the Conservation through Public Health CTPH, Makerere University, and with Professor Scott Ickes, Professor Heather Burton, and myself to conduct a research exploring waterborne disease transmission between livestock, humans, and gorillas in Bwindi, Uganda.
We make eye contact with the mountain gorilla, as Helen and I did in the remote forest in Uganda. You'll be struck by their human-like eyes, their eyes, their hands and feet, their playfulness and social behavior, even their unique abilities, are all evidence of them being one of our closest ancestors. We share 98% of our DNA with mountain gorillas, but this is also one of the reasons why they're unique. I'm Sarah Shadowd. I'm Helen Tippett. We traveled to Uganda to conduct a research project on zoonotic disease transmission between humans and animals around shared water sources and how this transmission affects public health and global. This interconnectedness that Saoirse talked about comes at a cost. Yes, gorillas are some of our closest animal cousins, but this genetic similarity allows for diseases to be spread easily between humans and gorillas. The specific disease we studied here over the summer for our research is cryptosporidium, which is a zoonotic waterborne parasite that is responsible for taking the lives of over 100,000 people every single year. Our research took a multifaceted approach where we teased out how water sources can be used to facilitate disease between gorillas, livestock, and communities. We worked in conjunction with two students from Makerere University in Uganda, Mary and Stephen. And we each took a different section of this project. And talking about human communities in particular, these are often those with limited water and resources to sanitation and hygiene access. And are often some of the most marginalized communities who can bear the burden of this disease. To tackle this problem, we worked with Conservation through Public Health, or CTPH. CTPH is a Ugandan NGO that takes a One Health approach to conserve biodiversity. Their One Health approach is the idea that human, animals, and environmental health is all interconnected. Our project aligns with their One Health approach because we're looking at how disease transmits between humans and animals through shared water sources. We approach this problem through three different levels. First, we need to identify how animals affect zoonotic disease transmission. To do so, we want to identify the prevalence and burden of cryptosporidium in both livestock and rural. Then we want to understand how humans use water resources and how they might be at increased risk with the disease. Finally, we want to combine all of these factors into a hotspot map that will show which communities are more vulnerable, where disease is occurring, and also areas that might be good for transmission mitigation. For our methodology, we surveyed over 100 people from 5 different study villages, and we asked them questions regarding water, sanitation, water inequality, access, getting at their perceptions of disease spread between gorillas and humans, and how their water and access affects them. For fecal samples, we took samples from 175 livestock species, sheep, cows, and goats, from, again, these same study villages. This was done invasively and non-invasively. And for gorillas, we sampled from 4 different mountain gorilla groups within the forest, totaling 36 individuals. For water samples, we chose 30 water sources from village surface water sites, but then also sites that transferred water between human and the forest communities back in. We found that gorillas have the highest proportion of cryptosporidium presence, followed by our livestock species and then water. In breaking down the gorilla burden even further, we can see that none of the 4 groups we surveyed have less than half negative, with Rushigura and Kotwe being. For more statistical power, we used a generalized linear model to account for non-normality of the data and found an R-scores value of 0.78, with a strong exponent. This looked at gorilla group versus cryptosporidium cysts per gram for our fast acid stain slides. And we compared Binindo to Habanyanja, and that found no statistics. But Kotwe roughly doubles the mean cyst burden as Binindo, and Rishigura found 3.5 times the cyst burden of both Binindo and Habanyanja, meaning that Kotwe and Rishigura were statistically. Applying our GLM to our livestock species by proximity, so this was closest livestock herd to our closest predator group, we found no statistical significance for cattle or sheep, which is surprising as cattle is typically that poster child for cryptosporidium. But we did see that goat parasite burdens did vary depending on which gorilla group they were in close proximity with. And so we found an R-squares value of 0.64. And that goats, specifically near Rishigura, had a 6-fold higher cyst burden than lowest women. So for implications, again, this is surprising as cattle are normally more associated with crypto, but within the context of the community, makes more sense. This can make more sense as goats are kept in this higher density situation and are often fed directly on the ground, like in these pictures, where they're able to reseed crypto through this fecal oil route directly. Cryptosporidium also thrives in this more damp wooded environment, allowing this to continue on in the goat population. So some possible solutions, depending on the community context and what we exist for them, could include clearing the pen, avoid directly feeding on the ground, and they could switch to a less intensive passing situation, or they could rotate pastures with an incompetent species like swine or poultry that would less facilitate this. They could also clean pens with undiluted iodine if there is an absence. Looking at this data spatially, we can see that there is a trend towards the western side of the map. And each of these are broken down in color by the livestock species or gorilla group, with prevalence being those larger circles. You can see there is less towards that northwest side. And I will pass it on.
In terms of the food, our biggest finding is that 71% of households we surveyed experience moderate to high prevalence food. We quantified this using water insecurity experiences and found that this is 2 times higher than the national Uganda. Water insecurity eliminates communities' water resource choice. 95% of respondents surveyed said that they couldn't use water was concerning livestock, gorillas, or both. However, high levels of water insecurity make it nearly impossible to avoid using the consumer. This could lead to increased disease transmission and consumption of proximity water. We also found that households that use surface water have higher levels of water insecurity. And 75% of the households we surveyed reported they use surface water as their primary source. Water sources ripe for contamination and disease spread because the same rivers and streams being used by people are also being used by livestock for land. We witnessed cattle and goats walking around and defecating in the same water sources with people collecting. Piped and tap water, which is more consistent with unknown, is very inaccessible and easy to source. We also found that sanitation and hygiene practices that decrease because of water insecurity. Communities are unable to perform practices such as washing clothes, hands, and body because of inconsistent water sources. This could also increase the risk of disease transmission. Limited water access also leads to tense emotions, such as anger, and shame. These emotions affect individuals because it places unnecessary stress on people who are managing households, and this disproportionately affects women who are primarily responsible for collecting and managing the water. Water insecurity, contamination, and sanitation are issues. They affect about half of the world. Water insecurity and contamination can decrease flow and increase the risk of disease transmission. Inconsistency of water sources may force people to have to travel farther to collect water, which could increase human-animal interfaces and decrease wildlife development through habitat destruction and stress. And finally, water insecurity can also cause instability in economic and social systems. Time spent collecting water is time spent away from work and daily duties. This responsibility also often falls to children, which can prevent educational opportunities and make getting an income very difficult.
We wanted to say thank you to the wonderful IIC and Luminary mentors, Dr. Scott Ickes, Dr. Saponalohani, Dr. Rutten, and Erica Rui. And we also wanted to thank Amuku Mary and Shiza Stephen from Makerere University, the two student partners that we worked with this summer.
And a big thank you to our partners, Conservation Partners, Dr. Goddess, Dr. Gloria, Gracious and Lawrence, and the entire amazing CTPH staff that really welcomed us and invited us along.
And a huge thank you to the Buffalo community for their hospitality, generosity, and kindness that allowed this research.
Greetings from Uganda. This is Dr. Gladys Kalema Zepseka, founder and CEO of Exhibition in Public Health. It was wonderful to visit William and Mary College in 2023, where with my husband, Lori Soka. We really had a great time talking to me and talking about my making gorillas. We're really excited both the William and Mary students here in Uganda and Bwindi Impenetrable National Park. It's been a great opportunity to have you over this summer, and it's been even more meaningful that you've been working closely with the students in Makerere University College and veterinary medicine. The study that we're doing, looking at water as a source of zoonotic disease transmission, is really going to add to our One Health response to conservation, that is improving the health of the people, the gorillas and other wildlife and livestock together, as well as the well-being of the local community. We have been studying parasites in the mountain gorillas for the past 20 years, and we found that typically the gorillas that range outside the park have a higher parasite burden. We pick up parasites from the local community and their livestock. But we had not really looked at the water sources and the role of the water sources in maintaining this zoonotic disease. So the research that me and Mary students from Makerere University students are doing is really going to help build upon our wild model and help us to know where we can preventively causes zoonotic disease transmission. We often talk to communities about having clean water, drinking from clean water sources, boiling the water, but this will really enable us to have more targeted interventions. We hope to continue to do more of this work together with you. And thank you so much for the great energy you brought to our team. Dr. Gloria Adiko, veterinary officer for CTPH, has been updating me on all that she did here. And I think she's really enjoyed working with me very much. And so our team at Bwindi Impenetrable National Park. We're looking forward to seeing how the project progresses. Thank you very much.